Hello everyone, welcome back to my nursing hub. So today in this video we are going to see blood transfusion reaction management. So already I have uploaded another video regarding pediatric blood transfusion. So the balance of that topic is blood transfusion reaction management. If there is any reaction occurs while transfusing the blood, what are the management we are going to do and what are the signs and symptoms of the types of reaction, all those things we are going to watch in this video. So first let's see what is a blood transfusion reaction. So as we all know, it's an undesirable and unintended occurrence during or after the administration of any blood component or product that could be considered to be related to the said product. So any kind of reaction. So we are not intending to get the reaction for any person if we are transfusing any kind of products, but sometimes it can happen due to many things. So let's see what are those reactions. So the main signs and symptoms of an acute transfusion reaction, otherwise called as ATR, are pyrexia or chills, tachycardia, hyper or hypotension, sometimes kids may collapse, rigors, flushing, urticaria, and sometimes you can see pain which can be in the bone, muscle or chest or abdomen, or sometimes even in the IV site. Also, some kids may develop nausea along with vomiting or without vomiting, and or generally unwell, or sometimes respiratory distress, hematuria, lip and or eyelid swelling. So the main management in case of any acute transfusion reaction is immediately post the transfusion, and we need to immediately seek the medical review and inform blood transfusion lab and hemovigilance. Maintain the IV access, assess patient, that is for airway, breathing, circulation, and Pew score. So Pew score is like all the vital signs. Confirm correct product for patient. Check the patient's details on ID band, match details on compatibility label. So even though we are doing it at the beginning of the transfusion, again we need to confirm if the product which we have transfused is the correct one or not. Then outrule underlying condition as cause of symptoms before discontinuing the transfusion. Sometimes the child may have any kind of febrile neutropenia or any other kind of reactions, any kind of underlying condition. So in those cases, we need to identify if the child has already any kind of underlying symptoms. So in those cases, we need to discuss to the medical team before discontinuing the transfusion. So as I said, if patient has febrile neutropenia or history of febrile pre-transfusion, consider continuing transfusion at slower rate, administer appropriate treatment, monitor patient closely for other symptoms. Now let's see the main reactions. The first one is febrile non-hemolytic transfusion reaction suspected. So in that case, we can see the signs and symptoms are pyrexia, that can be with or without chills and rigors. Again, maybe child may have headache or may not have headache. Again, nausea. So here in this case, the main management is if it is an isolated temperature rise, that is 38 degrees Celsius or more than or equal to 38 degrees Celsius, and 1 to 2 degrees Celsius rise from baseline. In that case, antipyretics may be given and we can continue the transfusion with close observation. If temperature rises more than 2 degrees Celsius above baseline or more than 39 degrees Celsius and or rigors or chills, then we need to stop the transfusion once other causes outruled and investigate. Then we have to send a sample from the child, that is cross and group and cross match. Then we need to send a clotted sample. Blood cultures we need to send immediately, that is central and peripheral. Then FBC, UNE and LFT, LDH, coax screen, D dimers, hepatoglobin, and we need to return the unit and send to the blood transfusion lab. Now the second type of reaction is acute hemolytic transfusion reaction. So here we can see the signs and symptoms as pain, that is in the flank, back, chest, abdomen or at the infusion site. Then pyrexia, chills or rigors, oozing, nausea or vomiting, tachycardia, hematuria, hemoglobinuria, dyspnea, agitation or fear. So the management here is we need to stop the transfusion, manage shock, and we need to commence IV fluids, group and gross match we need to send, clotted sample. Again we need to send the blood cultures, that is central and peripheral, and all the blood samples like FPC, UNE, LFTs, LDH, coax, cream, D dimers, hepatoglobin, and again we need to return the unit and set to the blood transfusion lab. The third type is if you are suspecting transfusion transmitted infection. So in this case, the signs and symptoms are again pyrexia, chills or rigors, hypotension and collapse. And the management here is again we need to stop the transfusion. We need to send the central and peripheral cultures. If it is red cells, repeat group and cross match. Commence broad spectrum antibiotics, and we need to manage shock, return unit and set to the lab. So the fourth one is if you're suspecting acute hypotensive reaction. Here in this case, the signs and symptom is mainly isolated hypotension. And the management is if hemorrhage is not causing the hypotension, we need to stop the transfusion immediately. We need to make the child lie flat, and we need to elevate the legs if the child is conscious. And if unconscious or nauseous, we have to keep the child in the recovery position. Then maintain IV access and manage hypotension, and we need to monitor views. Then the fifth one is if you are suspecting any urticarial or anaphylaxis reaction. So this is the one of the most common reaction which we can usually see in the kids. So if it is a mild allergic reaction, the signs and symptoms will be urticaria and or pruritus and skin rash. So in this case, we mainly manage with chlorpheniramine, and if symptoms resolve, we need to restart the transfusion slowly. And if it is a moderate allergic reaction, in this case we can see lip or facial angioderma, generalized urticaria. So here we need to stop the transfusion, and we can give chlorpheniramine and hydrocortisone as prescribed by the physician. Then the third type is severe anaphylactic reaction. So here we can see the severe hypotension, laryngeal edema, dyspnea or stridor, bronchospasm, wheezing or GI discomfort or hypoxia. So in this case also we need to stop the transfusion immediately and urgent medical review and anaphylaxis protocol, and we need to send investigations for IgA levels, chest X-ray and tryptase if it is severe case. So the last sixth and seventh one is these are the most serious kind of complications which can occur due to the transfusion, that is transfusion associated circulatory overload or TACO. And the seventh one is transfusion related acute lung injury or TRALI. So if you are suspecting TACO, the signs and symptoms will be tachycardia, dyspnea plus or minus cough, cyanosis, hypertension and pulmonary edema on chest X-ray and left ventricular failure. And if you are suspecting TRALI, the signs and symptoms mainly we can say is dyspnea, hypoxia plus or minus cough, fever, hypotension, and no pre-existing lung injury but circulatory overload outruled. The management for this TACO and TRALI is same. So the main management we can see here are stop transfusion and assess ABC, chest X-ray and saturations, FPC, UNE and LFT blood samples for HLA antibodies, and BNB, that is a brain natriuretic peptide, which is a protein which is present in the artery. So we need to send that sample. Then we can give furosemide if we are suspecting TACO, and if it is TRALI, we need to do the CVP measurement and ventilatory support. So hope you are clear with the transfusion reaction signs and symptoms and the management. If you have any kind of doubts, you can write down, you can comment down below. Thanks for all your support. Thank you.